So how did I go from all of that straight science to now being extremely well known for my work on naming, measuring, and addressing the impacts of racism on health? It's because I asked, what is race measuring? And race is measuring the social interpretation of how one looks in a race-conscious society. And that socially assigned race is the substrate on which racism operates day to day. Race is measuring the impacts of racism.
We spend a tremendous amount of time collecting the dots. We need to spend just as much time in connecting those dots. And that's what Public Health Connects is all about. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. This is Public Health Connects.
So I am super pleased to have Dr. Kamara Jones join me today here at APHA for our Public Health Connects. And this is such an honor to have you here. Thank you, Dr. Jones. And I'm going to do my best to try to say something about you, but I know it's not going to do justice. But let me just for our viewers' sake say you are a family physician, an epidemiologist, a PhD epidemiologist, just to be clear, past president of the American Public Health Association, and a civil rights activist who specializes, and let me make sure I have this correct because it's very important, naming, measuring, addressing the impacts of racism on health and well-being, not just in our country, but throughout the world.
That is correct.
Have I done that justice?
You have done that great justice.
Tell me about you and your work. I mean, just so much to unpack, but just a little bit about yourself.
Well, I will just say that my work on racism comes out of being a physician who wondered why are physicians trained to, just to report to one another in that chief complaint, the age, race, and sex of a patient that they see. What were we doing damage-wise or limiting-wise in terms of focusing on race? So that was on the physician side. I was just uncomfortable. Why did I have to tell you that patient X was an 18-year-old black female presenting with abdominal pain versus patient Y, who is an 18-year-old white female presenting with abdominal pain? How does that, in the emergency department, guide how we approach that patient, what we thought could be going on with her, how we might think about solutions and that type of thing? So that was the question. I was at Johns Hopkins and I was, a teaching assistant after having gone through the courses. Sure. And some of the students, when I was a teaching assistant, students from the African continent, students from the European continent, would say, well, why do you all in this country just document all of your data by black, white, other, at the time, it was so long ago.
Wow, okay.
Why are you doing that? Why, what's behind that? Why does that seem to be satisfying to you and you're not digging deeper? So that took me to the question, what are we measuring when we measure race? Because we do see in this country over long periods of time across diseases, across age groups and all, profound differences in health outcomes by so-called race, right? But when you look at what race measures, it's a rough proxy for social class. I could go deep into that if you want, but I mean, for example, if you just even take a black-white dichotomy, black folks in this country are overrepresented in poverty, right? But not all black people are poor. The plurality of poor people used to be the majority of poor people in this country are white. There's not a one-to-one correspondence, for example, between black race and poverty. There is some correspondence that the fact that there's anything at all has to do with structural racism, and we can talk about that if we have time. But so race is a rough proxy for social class, rougher for culture. I could go into the same amount of detail, but we don't have time. Meaningless for genes. We've measured the human genome. There's no basis in the human genome for racial subspeciation. So the question is, why is it such a good predictor of health outcomes? It's because it measures the social classification of people in our race-conscious society. It measures that substrate. It measures the same race that if I enter an emergency department and I'm unconscious, somebody's going to check off my race. If I'm conscious, they'll ask me and I'll tell them the race that I have learned in this country. But that race is the same race that a police officer notices, or a judge in a courtroom, or a taxi
everyday-
driver, or
everyday
a teacher in a
interactions.
classroom. Interactions, and it guides our life experiences, life opportunities. This race is the substrate on which racism operates day to day to structure opportunity and assign value in this country. So when I understood that as an epidemiologist, I was a molecular biology major,
Oh, wow.
then medicine, then epidemiology, I mean straight science, statistician, like I've developed a system of statistical methods. This is my training. So how did I go from all of that straight science to now being extremely well known for my work on naming, measuring, and addressing the impacts of racism on health? It's because I asked, what is race measuring? And race is measuring the social interpretation of how one looks in a race-conscious society. And that socially assigned race is the substrate on which racism operates day to day. Race is measuring the impacts of racism.
So let me unpack something.
Yes.
If there is an argument that someone would make that we do not have racism in this country. Let's say somebody makes this argument.
Oh,
Yeah,
you think
I
it
don't
might?
know.
Oh.
I don't know who's making
That's a
that argument.
wild
Yeah, yeah, yeah.
supposition, but
So we don't have racism in this country because it's actually commingled with all these social class issues, whether it's economic or poverty or education or whatever it is. So how do you then say to somebody, wait a minute, we do have racism, we do have impact on people's health and well-being, and we have to do something about it. How do you get to the naming it and addressing it?
two important responses to your question. The first is that people often do say, well, you might call it racism, but isn't it really social class? Isn't it really poverty that we're talking about? Again, I could give you a long response. The short response is that it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That's not just a happenstance. And for each marginalized, stigmatized, oppressed group of color, there's been some initial historical injustice, which is now perpetuated through present-day contemporary structural factors, where those structures, policies, practices, norms, and values, those contemporary structural factors are part and parcel of what people describe as structural, systemic, institutionalized racism. So examples of the initial historical injustices are for indigenous North Americans, the taking of the land, the near genocide, moving people to reservations. In some cases, something good's found under one reservation, oops, you gotta pick the people up and move them someplace else. You know, we can talk about Mexicans who never crossed the border crossed them. They are still stigmatized and limited in the El Paso massacre. We talk about Chinese immigrants brought here to build our transcontinental railways, but in the Chinese Exclusion Acts in the 1880s, unable by law to marry, unable by law to bring their families here. We talk about during World War II, the internment camps for Japanese Americans. We didn't intern Italian Americans or German Americans. And for people of African ancestry, the initial historical injustice was the kidnapping of West African people, our importation across the Atlantic with tremendous loss of life in the Middle Passage, and then for the survivors and their progeny for generations and generations and generations, what I describe as the coerced usury of our unpaid labor for centuries to build this country. When people are ahistorical in this country, that is one of the things that makes them think, oh, there's no racism. If we get to talking about equity, I would love to talk to you about 7 barriers in our nation right now to achieving health equity, which are in our cultural mores, in our societal norms. So that's the first part, is this confusion about is it racism or is it poverty. Structural racism explains why we even see an association between social class and race in this country. So that structural racism is why we even see that. If it were not for that, if it were not for the historical injustices that are perpetuated, but with zoning laws and the fact that schools in most part of this country, public schools are still based, the funding is based on local property taxes, and when you have inaction in the face of need, when you see that disproportionately affecting some communities, but you don't care about those communities, then you don't address that. So those things, that is why we see an association between social class and race. It is not anything inherent about people of color that makes them more likely to be poverty or cultural or any of that.
Okay.
None of that. And there's nothing about white people, smarter, more, it's just historical entitlement and present day entitlement. Now, we never talk about white entitlement in this country either. So, I mean, like, you could talk to me for hours. We could
Yeah,
go there.
no,
but,
I wish you had
we're
more
not gonna
time.
do
Oh
that.
my gosh.
We're not going to do that. It is true that there are many systems of structured inequity in this country. So if you give me 30 seconds, I just want to define racism and talk about how we can generalize that definition to understand sexism, heterosexism, all these other things.
Okay.
But then why we need to address racism. So racism is a system of structuring opportunity and assigning value based on so-called race, based on the social interpretation of how one looks, that does three things: unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, because every unfair disadvantage does have its reciprocal unfair advantage. But the third impact many people miss, and that is that racism saps the strength of the whole society through the waste of human resources, as well as through how it divides some people from others in this country right now.
So it's an efficiency piece,
It's-
that we're less effective
Less
as a
effective.
nation.
We're wasting genius. We're squandering leadership, creativity, and all. We don't even see the genius in some communities. And the other way that racism saps the strength of the whole society, through the waste of human resources, through dividing us in our nation. We're feeling it. All of us are feeling it.
The tension.
That tension right now. And even dividing some people from their own interest, which we see in some voting patterns. So that's racism. What is sexism? That is a system of structuring opportunity and assigning value based on a different fill in the blank. That's based on gender, that has the same three impacts: unfairly disadvantages some, unfairly advantages others, saps the strength of the whole society. We could generate 15, 20, 25 axes of inequity operating in our society today, right? Coming together in communities and individuals. This is true. I recognize that racism is not the only system of structured inequity operating in our society today. I am with people who say, well, what about, poverty, and what about heterosexism? What about sexism? All of this. But what I will say is, of all that list of the axes of inequity, race, gender, language, immigration status, body weight, all kinds of things, and their associated systems of structured inequity, racism is foundational. So when you have something that is foundational in our nation's history, and yet many people are in staunch denial that it even exists, then we all need to mobilize and at least be actively anti-racism. I don't even say anti-racist. Why don't I say anti-racist? Because people might be like, oh, is she talking about me? I'm not talking about any individuals. I'm talking about a system of power.
Got it.
We all need to be actively anti-racism, even as we engage along those other axes of inequity, even as we struggle against sexism and heterosexism and the others. At least all of us be actively anti-racism. And then, to the extent that we're able to dismantle the mechanisms of racism, the other struggles will benefit as well.
So much to unpack. So much.
Sorry
to
to just like.
No. I want to make sure this is so. Amazing. And please grab some water.
Oh, yes, I think
just
I
make
will.
sure.
I think
Yeah,
I will.
exactly. So we talked a bit about our agency has these cornerstone values: equity, innovation, engagement. I know all three of those values speak to you, but I really want to focus on the equity piece, if that's okay. Health equity from that standpoint. You said there were 7 pieces of this that you wanted to talk about, like why we're not getting there. So I know you just talked about this issue about, do we have a race problem?
Or racism.
Is
I would encourage them. See, I
is
wouldn't even
race-
say, yes, I
right.
wouldn't say we don't have a race problem, we have a racism problem.
Racism problem, absolutely.
Absolutely.
Stand corrected. So with that, tell me about that health equity. How does it impact health?
Yes.
How does it impact? Society, yes, absolutely. But let's talk health.
Yes. Okay.
How would you unpack? How would you
May I
unweave
write
that?
on this paper?
You
I'm just gonna
absolutely
put on
can write on this
because
paper.
there are 3 things I want to do. So I'm just going to refer your viewers, listeners, to the Gardner's Tale. I don't have a long
Okay.
but there are 3 levels.
Gardner's Tale,
Right.
okay.
I'm going to talk about principles for achieving health equity, and then I'm going to talk about barriers. And I'm going to do that in like 2 minutes.
Okay. Wow.
But I just had to write down so I
Okay,
could keep.
perfect.
Okay, so I will say that racism impacts health through 3 levels.
Okay.
So what we describe as structural or institutionalized racism, that is the kind of racism that doesn't even require an identifiable perpetrator because it's been institutionalized in our laws, customs, background norms. This is the kind of racism that shows up as inherited disadvantage or its reciprocal inherited advantage. And we see it in our material conditions and access to power. So this is the racism that shows up as differential access by race to excellent educational opportunities, equal housing opportunities, clean environments, access to knowing people on the board, access to voting rights and full citizenship, all of those things.
It's some privilege.
It is the kind of racism that is so embedded
Ingrained, yeah.
in our structures that we don't even see it.
I see, okay.
There's other 2 levels that I tell in the Gardener's Tale allegory, which is one of the 4 that's in my TED Talk, is the interpersonal level. That's what most people think of when they hear racism. Somebody did something to somebody. That impacts health through police violence or teacher devaluation or being followed around in stores, and kind of what some people describe as microaggressions, that subtle communication of disrespect, which is not so micro to the one who's been aggressed. But that's that level between people, and that's where most people, when they hear the word racism, interpersonal, I call it personally mediated, because I recognize racism as a system. And this is a system mediated through people, so I'm still not putting the racism in the people. I know there are people who have racism in them, but we don't have to go there. Okay. If we address the system, then that will take care of itself. The 3rd level is internalized, which is experienced 2 different ways. From those who are structurally disadvantaged, it's acceptance of negative messages about our own abilities and intrinsic worth. So we feel like maybe we really are less than. Maybe we shouldn't try to get that job or try to move out of that neighborhood. And it turns into
Fulfillment. I mean, so we think we can't, so we don't even try.
Don't even try. Or we become helpless, hopeless, resigned. So then we have negative health behaviors and all, which is not just because of us, but because of our environments, which have been impoverished by residential segregation and then disinvestment, poisoning, all that. So, but those from the point of view of people who've been structurally advantaged in this society, the internalized racism shows up as a sense of entitlement, which then requires racism denial, because if you feel entitled to what you have, there can be no unfair system going on. Racism affects health through all these levels. Shifting to the relationship between racism and equity, well, first of all, there are 3 principles that I articulate for achieving health equity for all of us. Valuing all individuals and populations equally. Okay. Recognizing and rectifying historical injustices. Okay. And providing resources according to need. I want to carry on to the barriers to doing those 3 things. Well, first of all, racism as a system that differentially structures opportunity and assigns value based on so-called race is a huge barrier to achieving health equity. Because we are not valuing all individuals and populations equally. We are not recognizing and rectifying historical injustices. We are not providing resources according to need. So achieving health equity and racism, we have to address racism, right? But then in our society, there are what I have now, I started out with 3, now there's 7. You and I together, we could come up with 15, 20. But there are at least 7.
You give me a lot of credit, maybe only 12.
Okay, but let's talk, right? I mean, all of us as a society, let's talk. Let's think about these barriers. But I'm going to just name them quickly, the 7, and just like a little bit on each one. The first is that in our society, there's a strong, narrow focus on the individual. And when we're narrowly focused on the individual, it makes systems and structures either invisible or seemingly irrelevant. So we can't even talk about structural racism, structural sexism. The second is that we as a nation are ahistorical. What do I mean by ahistorical? I mean that we act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. The third of these 7 is our endorsement of the myth of meritocracy. The story that goes something like this: if you work hard, you will make it.
Got it.
Now let me tell you, most people who have made it have worked hard. I don't say everybody who's made it has worked hard.
Sure.
Some people inherit their position or their wealth. Most people who have made it have worked hard. Yet, there are many, many, many other people working just as hard or harder
Who don't.
who will never make it because of an uneven playing field, which has been structured and perpetuated by racism, sexism, heterosexism, all these systems of structured inequity. And when we deny the existence and pertinence of these systems, when we deny racism, we blame people who haven't made it for being lazy or stupid, right? The fourth of these 7 barriers is our endorsement of the myth of a zero-sum game. That if you gain, I lose. This is not true, but it sets us up in competition with one another. It masks the cost of inequity to the whole society. The fact that racism saps the strength of the whole society is masked when we think that, well, if you gain, I lose. And it limits our efforts to grow the pie. The fifth of these 7 is our, in this nation, limited future orientation. Now, the parts of the future that each of us could touch today that will hopefully survive us are the children and the planet.
Yeah.
We all hope that the children and the planet will
The
survive
next
us.
generation.
Right. In this country, we have a disregard for the children and a usurious relationship with the planet. There are other societies, even in this nation, Native American groups have a 7 generations,
7 generations, yeah,
policy.
we
But
know
they
that,
think about
yeah,
it.
that's
That's
right.
right. Or, 100-year plan. Do we? And in fact, people in the Maasai people in East Africa, I have not spoken with them. I am told that when they greet one another, it's not, oh, hey, how you doing, Amira? It's, how are the children? That's the question they ask each other, hoping to hear back the answer, all the children are well. In this country, we don't even ask how the children are. And if we were to ask, we certainly wouldn't get the answer, all the children are well.
Even
This-
in my culture, that's
That's a thing.
the notion of 7 generations is a bit different, but it's similar. It's what are our elders? What's the wisdom? What have they contributed? What is it for today? What is it for tomorrow? What is it for our future? And let's talk about that.
And
you unpack it very quickly. It's a very quick. In a greeting, you get all that, and it's almost inherent in how we approach our relations.
And you agree, that is not what we do in this
It's very
main
different.
US. Very
It's
different.
very different.
Very different. We don't even respect our elders on the other side, too. So in this country, disregard for the children, kind of discard, not even disregard, but discard of the elders. Yeah, we're just like in the present,
Yeah.
And then the 6th of the 7, and I know I'm taking a lot of time, but I appreciate your interest in this, is our sort of endorsement of the myth of American exceptionalism, which gets in the way of our achieving health equity in a global sense. I mean, when I was in the UK for a year, it's a myth of British exceptionalism. Any of these countries that have grabbed lots of stuff, there's this myth that we're so special, so ordained by God, so entitled to all that we have that we can't even learn from others. But the 7th of these 7 basic cultural variables or societal variables that are barriers to achieving health equity is actually the foundational one of my interest, which is white supremacist ideology. Now, why didn't I say that first? Because I wanted you
wanted to be
and
able to
everybody
hear
to
all
listen.
6.
That's right. I want people to hear it. There's people like, she said it. Right. Okay. So, like, no lightning. I'm not trying to do a lightning bolt thing.
Sure.
All 7 of those, you'll see, that's not even the structural stuff of how we fund public schools. That's not even the structural stuff of, redlining. It's not the structural stuff of how, people, the school to prison pipeline. That's not that structural stuff, but these are the value things. And so we need to attend to those and address those too in how we are with one another, how we teach our children. Maybe the faith community has something to do with that, but until those are changed, we really will not be able to make much progress, not only against racism, but any of these other systems of structured inequity.
Wow. I love it. Okay, I have 2. First of all, I wish I could go the whole day because we could. There's so much to unpack and so much wisdom and so much of what you've said, and there are so many nuances. I wish we had more time. I'm gonna ask 2 final questions. One is this question about what gives you hope. So we've talked a lot about all the impediments and challenges and perhaps how we're not getting there. But let's say and let's not look 20 years from now, perhaps maybe that is the better question. Let's just say a year from now.
I think that more and more people are aware that collective action is what is going to save us. I think more and more people are understanding we do have power as individuals to do things, to name things, name racism, put things on agenda, hire people, invest in things, but that real power is collective action. Collective action informs us, it inspires us, it propels us, it protects us. So I love coming to the American Public Health Association annual meeting because there is such a sense of a collective commitment to the well-being of all of us. What distinguishes public health from medicine, I'm both a physician, at the individual and public health, but it's understanding that the individual is important, but that the environment affects the individual for all of us, and that if we start caring about all of us, then all of us will flourish. So I guess coming to APHA gives me hope. I mean, honestly, I'm quite fearful for our country right now. So when you ask me what gives me hope, I guess just, I don't know. But collective action.
And that's okay.
The other thing, though, is that
not to know, because there is a lot of uncertainty right now.
there's a lot of uncertainty.
And I'm seeing this a lot, especially with our next generation, our kids. They're seeing a lot of uncertainty.
Yes, and a lot of even lack of willingness to have kids of their own because they're worried about the future.
Yeah.
You said, let's not talk about 20 years, but the 20 and 25-year, I guess, horizon looks better to me because that's how long it's going to take for our efforts that we start today to make a long-term, but we can't say, oh, it's going to happen. Right, we can't say,
We gotta start today.
we have to start. We have to plant acorns today so that our grandchildren can have shade. That is how I'm looking at it. So we may not see instant results, but as long as there is a commitment to address these issues, as opposed to a shying away from them or denial that they're issues at all. As long as we get more and more people, as long as we're passing the batons across generations, what worked when you tried it, what didn't work, what are your new ideas, and we keep that going, that I think gives me hope. And we see that here at APHA, and I see it in our anti-racism community across the nation and across the world.
So you said acorns. I'm going to segue to apple seeds.
Okay.
So as I mentioned, we have our new health and wellness initiative for all 8 million Washington people, and it's Be Well Washington, and it's for health and wellness initiative around 4 pillars of movement, nourishment, emotional well-being, and social connection. And we're asking everyday people is, what's your apple? Find your apple. What's your apple? And so some people said jazz, other people said, just taking a walk with my kids, whatever. So I'm going to ask you, as I give you this apple, Dr. Jones.
Yes.
What is your apple? What gives you that peace?
At an individual level, it is meditation, it is running, Zumba classes at the Y.
Oh my gosh.
I went on a 2-week bike tour just recently.
Okay,
in
so many
Sicily.
apples.
So many apples. But the real thing is being in this sense of community, feeling that I have barrels of batons. Not only am I handing a baton back to one person, I have fashioned barrels of batons. And each person who receives a baton from me in this work is to fashion their own barrels of batons. So my apple is that I am a teacher, and I feel that I have been effective in communicating, and if a bus hit me this afternoon, I would be okay because there are many people who have received my barrels of batons.
Many seeds.
Many seeds.
There you go, Dr. Kamara Jones. Thank you so much. Oh my gosh, what an honor. This has been amazing. I wish we had more time.
Well, thank you for the invitation.